Welcome back to Critter Corner. Today I'd like to talk a little bit about what you might expect if you get or adopt or purchase a new puppy or kitten. We get these calls all the time where clients are so excited, they have a brand new member to their family, and they're looking to get them in for that veterinary visit. But what sometimes we don't know, or what clients don't expect, is exactly what does that entail, because there are quite a few costs that are associated with those early months of having a new animal. A lot of it has to do with how old the pet is at the time that you acquire them. If they're very young, you may need to expect anywhere from 3 to 4 visits at your veterinary office, usually spaced about a month apart. And if you get an animal that's over 4 or 5 months old, it may only be 1 or 2. A lot of it depends on what was done prior to your obtaining the animal. Most of those visits are, one, to make sure that your pet is growing appropriately. We spend a lot of time looking for congenital conditions, developmental issues that might arise as the animal grows. Make sure that you're feeding the animal the right amount of food that they can grow appropriately. Keeping up on that vaccine series. So this is what I love about COVID. Everyone understands vaccines now. So if you recall when you got your COVID vaccine, or if you know someone who had one, you needed to have 2 vaccines spaced out about 4 weeks apart. That is pretty standard when it comes to vaccine boosters for most species, including animals. But it's different with pets because they do develop a lot faster. So when you have an adult animal, that 2 boostered about a month apart is about right. But a young animal, you need to do that maybe monthly for 3 or 4 months until we can expect a response. Part of this has to do with the fact that they get protection from their parents, from their mom. When they are born and they're nursing, they are ingesting those antibodies mom does already have to those vaccines, and it takes a while for those to fade. If you vaccinate an animal before those have completely faded, their own immune system won't recognize the vaccine. And once their immune system is able to recognize the vaccine, if they don't have enough boosters beyond that period of time, then you may not get an appropriate response, which leaves your pet at risk. So this is one of those situations where you really want to work with your veterinarian to understand how many visits you need and why. A lot of things that we're doing these days are trying to split up vaccines so that pets aren't getting a lot at one time. It may increase the number of visits, but for smaller patients, your veterinarian may recommend that. This is important because those visits can be a couple $100s a visit, and if you haven't budgeted well enough for that, you may find yourself struggling. The other thing that tends to come up in the first year of life is a spay or neuter surgery, and those can vary depending upon the size of the animal, the type of animal, and which veterinary hospital you're at. Those procedures don't have to be done in the first year of life, but there are medical benefits to doing that for, say, cats and female dogs. Male dogs, we now wait till they're older, but there are complications that can arise from an adult dog neuter. And sometimes clients aren't prepared for those types of complications, and that adds expense to your budget. So make sure that you know what you're getting into when you adopt that pet so we can make sure that they have the very best care. Some of the other things that are unexpected expenses in the first year or 2 of life. Puppies and kittens are curious, and sometimes that curiosity leads them to do things that put them at risk. For example, I might chew on that object that just fell off the table and swallow some of those pieces, but those pieces may cause me problems later. Depending on the object, the size of the dog, your veterinarian could recommend a wait and watch approach. They may recommend x-rays, they may recommend trying to make them throw up the object, or they may recommend surgery. Obviously, surgery can be quite expensive, especially if it occurs at the night or weekends and you find yourself at an emergency hospital. They often charge more. So when you are considering bringing a new pet into your family, specifically dog or cat, we want to make sure that you are prepared for those expenses. One of our previous episodes was about pet insurance. I would love for you to reach out and take a look at that. And if you have any questions about pet insurance for your pet, please be sure to speak to your veterinarian.